That's a good place to start. And yeah, do you want
Yes.
to sort of talk through your career history?
Yeah, sure. So I trained as an OT as a postgraduate degree. So I did an arts degree first of all in Edinburgh, and then I volunteered abroad. And then when I was abroad, I worked, and also I'd done a lot of volunteering during my time at university. I kept coming across occupational therapists, but I'd never really heard of them. I mean, a lot of people haven't heard of them when they're at school, have they? So
No.
so, but they seem to be everywhere. They were in kind of homeless projects and mental health projects, and with children. And so I kind of thought, well, this is really good. It's really broad, and you can do lots of things. So I trained as an OT, and then went into community social services work, so seeing people at home and doing adaptations of equipment. And then I did the adaptations course that I was talking to you about, the Architectural Association, and I was interested in adapting historic buildings because my first degree had been in history. So I was thinking it would be really good to make them more accessible. But then I got into paediatrics, and I really, really enjoyed paediatrics. So I was working in community, and then in schools and in short break services, helping young people to access just everyday activities like ballet classes and climbing and judo and all sorts of things. And then got into and did a cover for a year in a neonatal intensive care unit, and really enjoyed the acute work. I thought I was always going to be community. Then I went into acute. Then I ended up in Great Ormond Street doing neurology and neurosurgery, so with kids with brain tumours. And I wasn't doing the neurosurgery; I was an OT in the neuro wards. so yeah, it was. So went from very, very community based to really intensive tertiary services. So I've had quite a big, broad kind of range of experience. Yeah, that's kind of where I was at until September, and then in September took the secondment as a clinical fellow.
What's the title? So it's clinical fellow in sustainable health.
It's the chief sustainability officer's clinical fellow. So there's clinical fellows for medicine. It's the chief medical officer, and then for pharmacy, it's chief pharmacy officer, and then there's the same for dentistry. And there's quite a lot of them in overall. And then the chief sustainability officer funded 10 clinical fellows throughout the country, so for a year's secondment. So the aim is really for all of those clinical fellows is to get some experience of leadership. But with this chief sustainability officer, it's really just thinking about as clinicians as leaders, but also for the sustainability stuff, it's kind of thinking about NHS net zero and how we drive that forward from a clinical point of view, and think about the delivery and engaging the workforce, and clinicians know where the changes need to happen and can also talk to other clinicians, but also to have that kind of background in some leadership training that helps you to look at things in a slightly bigger, more policy and kind of on a higher level, really, I suppose, not rather than day to day as well. So
it's quite a jump from working as an OT in paediatric setting to this role, isn't it? So how did you make the jump?
I mean, what prompted it?
And I suppose I think you were a Green champion, is that right? In one of your NHS
that's
roles?
Right. So I was I joined the Green Champions. I was kind of interested in sustainability forever, but as with many of us, kind of was doing it at home but not thinking about it at work, and then just getting frustrated with the waste at work, and joined the Green Champions. And I suppose it really started because I was working with a young person who's had a period unexpectedly, and who couldn't manage their periods with traditional products because they couldn't use their hands, because she had an operation because of her epilepsy, and she had a hemiplegia, so she couldn't use all down one side, which meant that she couldn't manage traditional products, and it was her first period, and you can imagine how upsetting that was and difficult. And as OTs, we're thinking about activities of daily living, and I was thinking, well, if she can get her pants on, she can manage with period pants, she can be independent. So she was then able to do that by herself, and not have to rely on on staff or her parents to help her, which is a huge thing in terms of kind of dignity and independence. And so I wasn't really thinking about it from the sustainability point of view, but then I thought, we should be providing these products. We should be thinking about sustainability within that. And it became a big project for me because they didn't have any products in the hospital at all. Never mind sustainable products. There was nothing. So in terms of period products. So, and then I was very lucky to be able to get a grant to do a pilot project on that. So
that's amazing. That's a huge change, isn't it, in the hospital to bring that in?
Well, we were very, my argument was that we got quite a lot of money, so we could try it out. We got really good feedback. It's really about independence. And so if we can't, if we provide wheelchairs for people, we should be able to provide pants for them so that they can be independent. And in Scotland, of course, they have free period products for everybody in all hospitals and workplaces and colleges and things. So, and schools. So it's something that we should be thinking about. It's an enormous waste that's produced by.
So that was through your Green Champion role that you did that?
Well, no, and that was through my OT role. So that was really just through the OTs. And then because I was with the Green Champions, there were lots of people who could help. So there were people who were there from IT and they could help. So we could change the website and give people information. There were people there helping. We could change the pro forma. So when the nurses were saying, well, when they come in for operations, young people are asked whether they are pregnant. They're all tested, but they're not asked if they're having their periods yet. And we don't give them any information. We don't tell them that operations anesthetics can induce periods unexpectedly. So we need to change that. We need to add in those questions. So it meant that all those links with the Green Champions meant that we could change the pathway so that people had the information. They could make their own decisions. They knew what to expect. And then people from procurement helped as well in that whole kind of like how we're going to get this in terms of the procurement chain as well. So through that, and then also I suppose through that as well, I cycled from London to Glasgow for COP26. So
well done.
There were a whole crowd of people, paediatric health professionals working with children, who took a letter from the World Health Organization in Geneva that was cycled over to London, and then we took it from London to Glasgow and presented it to COP to talk about and it asked people to consider the issues about climate change and how it impacts children's health and in particular air quality, which is why we cycled there. And so we were I met lots of people through that because there were people from all different hospitals around the country. Different people joined on different days, and that really encouraged me. And then from that, somebody asked me if I would be a governor at the hospital as a Green governor. So I ended up being elected as a staff governor, and then I found out about the clinical fellowship, and that's how I kind of got into it really. And I was lucky enough to get that sustained secondment for a year.
Amazing. So it's one year. And did they have ideas of what they wanted you to do, or when you went to interview, did you say, if I get this post, these are the things I propose to do? How did it work?
No, when you went, because we are all different backgrounds. So there's doctors and there's surgeon, there's public health, pharmacist, midwife, ICU nurse. So then people were in different places. So some of them are central. So there's some people at the Health Foundation, which does research, or the BMJ, which is the British Medical Journal, and the Chief Nursing Officer. But some of us were I'm hosted by Sussex Integrated Care Board. So it was really up to Sussex to decide how they wanted to use my time. But they've been really great about letting me make a decision about how I do things. There's certain things they want me to do, but I'm part of their sustainability team, and working particularly with AHPs. And then because I was organising Greener AHP Week, that's helped with building networks and meeting people. And so some people some of the fellows have got very strict guidelines about what they do, and others don't. So it's quite flexible. But we do. The Greener
Sorry, go on.
No, I was going to say we all have to do some leadership training. and we all part of Greener NHS, so we all have that kind of training at the beginning about sustainability and how all the different work streams there are connected, and we all contribute to that in terms of going to the weekly meetings and that kind of thing. So
brilliant. So you mentioned the Greener AHP week, so I'll ask you about that in a minute. What are the other things as well as Greener AHP week that are involved in the role?
So the Greener AHP week wasn't really part of the role at all. So that was that's the Chief Allied Health Professions office. They normally have a fellow, but last year they didn't. So they asked if we would help out, and so myself and one of the speech therapists ended up helping out. But which was more than just helping out, really. It was quite a lot. It was really great experience. It was really good. But the other things I'm doing, so in Sussex, there was part of two applications for grants. So one was looking at virtual neuro rehab and how that could what needed to be involved in terms of it, and make sure that the outcomes were as good for patients as face to face. So think about that. So we were lucky we got the grant for that. So now part of that project is looking at what do patients and families want. How is it going to work? What do staff need in terms of training, and what the outcomes are in terms of virtual rehab, and then also the carbon footprinting associated with that, savings that might be associated with that. There's really good outcomes in that actually so far. That been fantastic feedback from patients and families, and also that cuts in waiting lists. People can be seen more often, and they don't have fatigue and all that kind of thing. So or they can have the fatigue managed at home rather than traveling. So yes, there's lots. So that's one of the things, and the other one is looking at a green impact assessment tool, which is how it's basically a way of calculating where the carbon hotspots are within a clinical pathway. So from somebody needing to see the GP, to having tests on their blood, to having to go into A&E, to being admitted, to going home. Where are the hotspots? Where can we change things? And it's a tool to help with that. So it's
amazing.
Yeah. And then the other thing, I suppose the thing I started with. Sorry, I feel like
it's fascinating.
The thing I started with was looking at how we could do equipment recycling and reuse, because that's something that I felt I could go and talk to people and get to know everybody and how things worked, and what might be important, and that was one of the things that had come up. So.
And how's that going, that project? Because I mean, as any community knows, you often turn up at a service user's house and the spare room will just be full of equipment and forever sending stuff back which they're not using anymore. And I think there's also a bit of a sort of risk-averse culture where someone doesn't actually want a bit of equipment and they say they probably won't use it, but then they get issued it so just in case, and there's a lot of waste, or then stuff gets ordered but then the community equipment service turn up on their doorstep and the customer says, well, I said I didn't want this. So there's a lot of waste that goes on in those respects, isn't there?
Absolutely. So asking those questions around prescribing is really important. Like, so the first thing, not just the reuse, but how do we stop the over prescription of everything, medicines as well as equipment, and also making sure that, we talk, like you say, you go to people's houses, they've got 3 walking frames and they're not using any of them, or they've got washing hanging on one or something there, and just kind of thinking about how what the systems are, how you need to do it to make it as easy as possible for people to reuse those things or bring them back, or they bring them back to somewhere local. They don't have to take them back to the big hospital where they are, so that it makes it easy for people to bring them back when they're finished using them, if they've got a broken foot or something. And that clinicians feel confident, like you say, not the kind of risk averse about we need to issue new ones, but for walking aids particularly, and for a lot of equipment, they just need to be wiped down and then checked over. And when you're actually giving something out to somebody, you're making a risk assessment of what they need and how it works before you give it to them anyway. So if it's a reused thing, you still have to do the same thing. So it's been a bit tricky. There are challenges with that, just because there are contracts in place, and people want to continue those. But I think most people do want to do that, and most trusts that have done it, I think 100 trusts in the country have already done it, and they're able to that for walking aids, and they're able to save an average of £45,000 a year. So it's a lot of money for and as well as the carbon and savings.
Yeah, it's a big difference, isn't it? So AHP week was about 2 or 3 weeks ago now.
Yeah, 2 weeks ago. So that's right.
2 weeks. So there was a whole week of different online events, wasn't there? And really lovely wide variety of things. Do you want to talk through how that went and the organisation and?
So we knew it was going to be online and it was going to be free, and we were working with the Chief Allied Health Professionals Office, so that we had a bit of admin, somebody who could do some things on the website. And also the Centre for Sustainable Healthcare was really helpful. They said that they would host everything on their platform, so we could do tickets with them. And then it was really talking to people, putting a call out, trying to get people to say if they had projects they wanted to showcase. Trying to make sure we had a really good range of mental health, physical health, community, and acute stuff, education, a lot of education stuff with students presenting as well. And people from Greener NHS talking about pathways as well, and what Greener NHS actually is, because most people have never heard of it. So there were lots of kind of, we were trying to think of ways to include lots of different things. I think they weren't expecting it to be quite so big, but lots of people are doing great things. So that was, and I think it's really important that people see things in their own area as well. So because you might do a really great seminar on diagnostic radiography, but that people don't think that OTs or physios don't think that's got anything to do with them, and actually they're probably lessons across the way. So we were lucky. We had lots of great people offering. So
it was great, and it's all on YouTube now. So on the blog, I've put the link to it. So because I wasn't able to attend any that week, so I've been starting to listen back this week on YouTube. And you mentioned the period. Yes, there's the YouTube address. You mentioned the period products that you started using with your clients in hospital, and there's a fantastic presentation. I can't remember the lady's name now, but she talks through different. Yeah, she was brilliant. Different period products, and also looking at the impact of both on our own health because of the chemicals and the microplastics in the products, but also just the sheer amount of landfill that's produced every year through the period products, and it's really shocking, isn't it?
It is, yeah. Yeah, Sam's great, and presentation. She's really engaging, and she knows so much. It's really and it's something that we can, a lot of us can actually do something about. So in our own lives, I suppose.
I liked her presentation as well, sort of going off on a tangent a bit from the greener aspect, just the importance of OTs talking to clients about their periods and their period health and how they manage that and how it impacts their ability to engage in their occupations. And it's certainly something I've not really talked to clients about, so it's something I'll consider in the future.
Yeah, and it is like we were saying before, is that we have those performers, and we just get stuck into them. We're going to ask these questions rather than thinking, what's that? We ask about going to the toilet a lot and dressing, so why would we not ask about period health as well? So
yeah, absolutely. And the virtual neurorehabilitation that you mentioned, there's a talk on that as well. That's on YouTube.
Yeah.
So that's interesting, isn't it? And sort of making the service more efficient, so there's less need for the OT to travel out if sometimes the appointments can be done online.
Yeah, and it's giving people the choice as well. So it's not saying, oh, we're only going to offer this. It's that it's giving people the choice and saying, look, we can see you very quickly if we see you online. If you don't like it, you can absolutely go back to face-to-face or go to face-to-face. But a lot of the things like cognitive support and planning and all those things can be done virtually, and they have therapist assistants as well who can go out if somebody needs that extra support for whatever reason. So and that means that the therapy assistant then has a professional qualified neuro person who actually in that case lives in Manchester but is doing the clinics in Sussex. So it means that in terms of, like, if you're thinking about staff retention or getting the right people to do the right job, that those things are really helpful, because you've got a bigger range of people to ask, and it also really brought down the waiting list, so that people who needed more intensive care could get that from the other people, staff there, and not waiting a long time.
And there was another talk about greening the community fleet. It's not one I've watched yet, but that's a big thing in community work, isn't it? Especially in rural areas, the amount of petrol that's burnt sort of driving around between visits.
Yeah, I mean, that's an amazing talk. I would really recommend listening to that. So Sue Norman, who's she was the Greener AHP of the year, and she's an OT, and she was thinking it would be really good to go out there, like, and if you've done community work there, and I've done community work, and you think, oh, just wish I had a van, I could take everything at once when I go to see this person. And she was working with an advanced, she's an advanced practitioner, but she was working with paramedics and nurses, so that they would go out together. If somebody had a fall, instead of phoning the ambulance, they would say, okay, we think it's appropriate for you to go. They could go and see somebody. They could do the whole OT assessment, the whole nursing assessment there and then, check their medication, make sure that they weren't hurt in any way, give them the equipment they needed, keep people at home rather than take them into the hospital, keep them there, keep them waiting until they could get equipment at home, and make sure it's really appropriate, because you've got everything there on the spot. So it's a really so as well as being an electric vehicle, it's a much better service for people. It's much nicer for them to stay at home. And of course, every time you're admitted to hospital, it's got a huge carbon footprint as well. So carbon emissions associated with that. So, and most of us don't want to be admitted to hospital. So it was a really much better service, I think.
I know there's an initiative. Sorry, go on.
No, go on.
There's an initiative somewhere else in the UK where the carers are being offered electric bikes to use to get between their calls as well. And if you're working in a city and that's doable, it just makes sense, doesn't it? Yeah,
there's lots of e-bikes for GP surgeries and for community nursing. And I mean, when you think about, we do, I think it's 155 million community miles, not non-emergency miles, and the health service every year. That's a lot of emissions. If we're burning fossil fuels, that's a lot. So and that's obviously got an impact on, cycling has an impact on your health and well-being as well as so for staff to be offered e-bikes means that there's much more opportunity for them to get out and about during the day as well. So yeah, it's great. Which
leads on nicely to talking to air pollution. I think I'm also a keen cyclist, and I'm very aware of the sort of impact of air pollution on our health, and also the benefits to our physical and social health if we're cycling or walking or any sort of active travel. I think that's a big area we can improve on nationally, isn't it?
Absolutely. I mean, air pollution is the most significant risk for health in the country. I mean, I think it's 1 in 20 deaths is responsible. Air pollution is responsible. So, and it affects the most vulnerable people in society as well. So we know that it's affecting older people and people with existing health conditions and babies, and it causes premature births and low birth weights, and it affects not just your respiratory health but cardiac. Every organ of your body is affected by air pollution. So, and dementia as well, including the brain. So there's lots of links with dementia as well. So it is a really big thing. And I think one thing that struck me was thinking about somebody was saying when an ambulance is called out, if it's a petrol or a diesel ambulance, they're called out to one person as an emergency, but every single person that they pass on the way there is affected by the pollution that they produce. And I thought that was quite a powerful image, really, to think about how do we do need to change this. It's not just for the individuals, it's for everybody. And it costs the economy like 20 billion a year in lost work days, and it's a really big thing. And we can do something about it because we're so big and the fleet is so big, and we can change all those journeys and people's perception about electric vehicles and how they work and how reliable they are. and it's really important for us to get, because the NHS has a target to get to net zero, that the fleet and our journeys are a big part of that. And like you say, it's also about well-being and health, and how we are moving around, and we've got so much more sedentary that people don't walk short distances or cycle short distances. And I think changing that way of thinking is really important to make that the first way of doing things. And not
changing the
can.
infrastructure as well. I mean, there's research by people like Sustrans and Cycling UK. You know, they're doing interviews with people, and so many members of the public, and especially women, say that they'd cycle more if it was safer, if they felt safer.
Yeah, absolutely, completely. And I think once it's about making it the easy choice for people. I think that's the same in
the enjoyable
food,
choice.
and the same, yes, and the same in everything. If it's I'm lucky because I live in London. There's buses every few minutes. I can get a bus quite easily, but people who live in rural villages where there's one a day don't really have that choice. So if we have the infrastructure there, it makes it easier for people. And I think within the NHS particularly, that's the case as well. So like you're saying, if we provide e-bikes, if we support people with cycle lanes, if we make sure that it's safe, because people have got separate roads to go, or separate places to go down, so that they don't feel that they're in fear of their lives when they're out and about. It's really important.
It is, and I'm interested in the wider conversations around population health, because this is choices that we make that affect not only our own health but all the people around us. And it goes to a global level, I suppose, with the effects of climate change. So the effects of our carbon footprint is affecting the health of people internationally, and in the poorest countries, with people that are getting affected by the floods and the droughts and the heat waves.
Yeah, absolutely. And those things are people, I think people do realize that they're happening now. I mean, everybody sees it happening, but we now kind of expect places to flood. We've had floods in this country all the time. We have had there's been forest fires in Scotland, you know, last year. This is not something that's happening only in California or really hot places. This is happening here now, and that has a huge impact on people's well-being and health and livelihood, obviously, and their homes, but also mental health. I mean, the mental health impacts of being flooded or having your home destroyed by fire are huge. And also, like, we're going back to air pollution, I think mental health is affected by that as well, in terms of well-being so it's a huge issue in terms of population health.
What do you think the role is for OTs? What can OTs do to try and improve their own actions, or the actions of their service users?
Well, I think that there's lots of things we can do. I mean, the thing is that OTs we're kind of in a really good place to be working on this, because we are a really good low carbon solution, aren't we? Occupational therapists. And I think it's really important that we kind of ask the right questions, really thinking about, when in work, can we use digital technology? Can we think about opportunities for asking people whether they want to walk or cycle or recycle, or can we stop over prescribing equipment, and make sure that we think about low carbon solutions in terms of whatever our input is, and we think about how our referral pathways can be streamlined, or whether if we've got students with us, can they have a project that's working on on sustainability that you don't have time for in your department, or can they spend a day a week with the sustainability department? Because there's quite often that the sustainability department will be really pleased to have a clinical person there, and also they'll learn a lot, and they can do projects that help the department. So I feel like there's a huge, from everything from your referral pathways to your output, to the way you deliver care, and the questions you ask, and having it as part of people's CPD, and learning pre-registration, post-registration, having it as a topic on every team meeting, so that it's completely embedded, like equality and diversity, which should be completely embedded, and we shouldn't have to talk about it, but we do have to talk about it because it's not yet. And sustainability is the same, I think. So,
are you aware of any OT education courses, or, you know, at the universities, how much sustainability is getting talked about at the moment?
So there's been changes in the pre-reg curricula for all AHPs, and that was done through the Council of Deans for Health. So it's now included in the pre-reg curriculum.
Okay.
And I think a lot of there's the Planetary Health Report Card. I don't know if you've heard of that. So so the Planetary Health Report Card is a student initiative that starts off in medical schools, and the idea is that it helps institutions to change, and it looks at the buildings and the curricula and research and community engagement, and it kind of does a report on those things for each course, and that's now being developed for OTs by somebody who was at UEA actually.
Okay.
And so that's a really good tool to help people think, well, where do I go next? How do we include sustainability in what we're doing?
Am I right that one of the talks during AHP week as well was on role emerging student placements in a green settings, placements that are promoting green health, so physical activity in green spaces, things like this? Am I right that there was a talk on that, or have I seen that somewhere else?
No, yeah, that's right. There was. Sorry, I lost you for a minute there.
That's okay.
Yes, there were two talks on student placement. One was on leadership placements, where they were looking at how to build sustainability networks and what was the best way to communicate, and how to spread the green projects that are happening within Yorkshire actually. And the other one was about placements in working with NHS. Sorry, working with Natural England. So encouraging working in mental health and supporting people who are using the services to do walks, and working with Natural England to create those kind of pathways, working with social prescribers, and there's quite a lot of people working now with the social prescribers to it's kind of empowering people to take control of their own mental health, as well as the green walking, and which we know that I mean a lot of people feel much better when they've been out for a walk in greenery, and we know that there's a lot of evidence now that people who are in beds in hospital where they've got a green outlook get discharged earlier. So it's a really health giving thing, and there are talks about that from the on the videos. There's a lovely one on Friday from somebody who works with NHS Forests, which is free trees for anybody who in the NHS. If you want to plant them on your site, you can get the free trees.
And this is great for staff health as well, isn't it? I've worked for community trusts and hospitals where in your base sites there's nowhere to go at lunchtime really, other than like a concrete courtyard or a staff room. And if you've had a stressful day with sort of quite an intense caseload, it's so important to have a green space to go and relax in for 30 minutes.
Yeah. And I think I do think I sometimes forget that. I forget that actually we're thinking about staff health as well as patient health, and in all ways better for staff to have green spaces, but better, they are more productive, they're happier, they're more likely to stay, there's less sick days, all those things, as well as it's just nicer for people to work in those environments. So.
Yeah, I love the idea of the NHS forests as well. If staff are involved with planting these trees, that if they stay remaining working there, they see these trees then growing up as well, which is really nice for them to engage with nature.
Absolutely, it's really lovely. And we planted a whole load of trees in Sussex recently, and I really want to go back and see them, because we planted them in February, and to see if they're thriving in the summer. So. Yeah,
absolutely. So how can OTs learn more? What sort of training and resources are there?
Well, there's e-learning for health. There's NHS has got an e-learning for health module, which is about half an hour. And there's lots of opportunities at the Centre for Sustainable Healthcare, which is a charity that puts on lots of courses, and some of them you pay for, some of them are events that you don't pay for. They cover every different area that you can think about. There's also lots. I would say join the Green Champions at your place of work, because you learn from other people, and meeting other people, reading. Obviously, people get lots of Green Champions. They'll have lists of books that people have enjoyed, or podcasts that they've enjoyed, or so I would say yes. The podcasts like there's the BBC Climate Question is really good, and there was a really good American one called it's gone out of my head now, so I can't so that's helpful. But yes, there's lots of things available. And in terms of the OT stuff, there's an OT network at the Centre for Sustainable Healthcare, and we have a monthly online meeting. It's really have one person presents on something, and then we have a chat, and it's very open and welcoming, and people drop in when they can. So yeah, there's lots of ways that people can learn and resources available. There's also the Greener AHP page on NHS England, and Greener NHS, which is a sort of strategy part of NHS England that deals with sustainability. Have got lots of resources as well. So lots to do, lots to get involved with. The e-learning you mentioned, is that the carbon literacy for healthcare? No, it's just called e-learning for health and care. I think I can put the link in the chat. Okay. And obviously all the recordings now on your Greener AHP website on YouTube. Yes, of course. Yes, all the fantastic Greener AHP recordings. Thank you for reminding me of that. I'm sure I meant to say that. It's brilliant. I think as well, sometimes we get sick of reading things, so watching videos is a really lovely way to learn. Yeah, true. Thank you. So your fellowships until September of this year? That's right, until the end of it was 1st of September till the 31st of August. So. And then what's next for you? Will you go back to your clinical role? So I can go back to my clinical role. I think I would really like to carry on using what I've learned and bring my sustainability learning into support changes for OTs more widely, I think, and kind of recognise the benefits that we can bring in there. I think it's all about better healthcare, really. So, and I think clinicians need to be involved in that. We know that we're trying to design better healthcare. We need clinicians involved, and that OTs are really good at keeping people healthy and thinking about care settings and system change. So, if there's an opportunity for me to get involved in something that's in terms of clinical sustainability, I'd like to do that. But there's not that many jobs at the moment, but I'm hoping there'll be more. I hope that on our carbon net zero journey, the NHS has done really well on thinking about decarbonising buildings and transport, but not so much about clinical pathways at the moment. So that's something that that's definitely going to be the next step. I was going to ask you about the adaptations and the housing. I know that's an interest of yours. Where can we go as OTs in terms of housing adaptations and sustainable design to make that greener? I haven't really looked into that actually, but it's a really good point. I know that the housing specialist section from the Royal College of OT housing specialist section had a day on sustainability at their conference recently, so they probably got lots of resources, and it's probably on the Royal College of OT website. But I can find out for you and let you know. You need to find out. Yeah. Brilliant. Well, I think that's all my questions, unless there's anything else you want to talk about. I don't think so. I suppose personally, people often ask, what can I do? What can I do in work, but also what can I do personally? And I guess it's quite important just to kind of think about how you people always think about recycling, and actually we like we were saying, was thinking about how you consume things in every way. So where your money is, what you eat, what how much you buy, whether you buy new or secondhand, all those kind of things. So I would say, I mean, we know that the biggest impact you can have is changing your bank to an ethical bank, and you can check that on Bank Track, it's the website, and stopping eating meat. So those are the two big things, and stop flying as well. So, but obviously those things are quite sensitive. People don't want to be told what to do, and there's no reason why you should be really kind of extreme about it. But if you can cut things down, then
it's being aware of your lifestyle, isn't it?
Yeah,
being aware of the impact of the decisions you make. It's interesting you mentioned the banks as well. I don't think that gets talked about much, does it, in the mainstream, sort of having an ethical bank account, looking into how your bank's investing your money.
Yeah. And how our professional bodies are using them, they're investing the money as well, our money. So and that's something that's come up recently. The UK Health Alliance on Climate Change has recommended that all professional bodies use ethical banks and move away from banks that are investing in fossil fuels, because it's not congruent with, if we're promoting health, we should be promoting health in every way, and that's not. And if we're then polluting the air because we're supporting something that's actually polluting, then that's a conflict of interests. So it's quite an interesting question. I know it sounds like I'm being really political, but actually our role is to promote healthcare and healthy living, and we should be doing that in every area.
Well, I was actually going to mention politics as the other thing that's a sensitive subject, and I think we should talk about it more, and be aware of who we vote for and the impact that has on the environment.
Yeah, I mean, it's quite interesting with it at Great Ormond Street. We know that we do these really life-changing operations. They can do heart and lung transplants for children. But if they live within 50 meters of a main road, then their chances of survival are dramatically less than if they don't. So we know how absolutely it's directly affecting the people we're working with. So I think we need to take that into consideration when we're thinking about, like, say, how we live as a society and what we're doing about that, because otherwise we're saving somebody, and down the line it's not going to work at all. So there's a really nice cartoon that one of the people on Greener AHP Week had shared, which said, we've got to stop pulling people out the river and look further upriver, why they're falling in the first place. So we need to think about how do we stop this problem happening in the first place. So
it's a preventative approach, isn't it, rather than just reacting once something happens.
So thank you very much.
Well, thanks for chatting with me. It's absolutely fascinating. You've been involved in so many interesting things. It'd be great to see what you do sort of after the fellowship.
Yeah, that's the tricky bit.